Doctors always ask patients not to take aspirin before surgeries. That's because the medicine causes blood thinning, which is the worsening of blood clotting. It can lead to poor bleeding, slow recovery, and other complications. Rapid blood clotting is necessary for the proper healing of scalpel cuts. But did any surgeon ever tell you to avoid Chinese food before surgery? And what about excluding ginger, garlic, black mushrooms, or fatty fish from your diet? The point is that all of these products are anticoagulants that can significantly reduce blood clotting, so they have the same effect as aspirin. These foods block the action of thromboxane, the substance that slows down the accumulation of platelets, which is an important stage in the formation of clots. Fatty foods like cheese and meat thicken the blood as they make platelets stickier, and so they form clots easier. Also, some products change the level of fibrinogen. The substance plays an important role in the formation of clots and affects the period of their dissolution. Moreover, there are foods that affect the viscosity and fluidity of blood by promoting or preventing the formation of blood clots that can block the vessels of the heart, brain, legs, and lungs. There is no doubt that regular consumption of even small amounts of some of these foods can have a great effect on the blood's tendency towards thrombophilia and thus save the cardiovascular system from the catastrophe. One of the most important means of preventing heart attacks and strokes is the consumption of foods that have a positive effect on the factors of thrombus formation. So now we are going to tell you about what you should and should not eat. Before we move on, please subscribe to the channel to get notifications about our new videos. We're doing our best to create interesting content for you. Onion. Onion is a major source of organosulfur compounds, thiosulfates, as well as flavonoids, which have several remedial benefits such as antiplatelet activity, antimicrobial activity, anti-inflammatory, and anti-asthmatic effects. The problem is that if you cook or fry onions, the unstable sulfur compounds disintegrate to form compounds that are not at all beneficial for the human health. N. Gupta, MD in medicine from the Medical College of Lucknow, India, conducted an interesting study. First, he gave his subjects a high-fat lunch with butter and cream, so it was determined that the body's ability to dissolve blood clots decreased significantly. Then the scientist gave them the same meal, but this time with 60 grams of raw boiled or fried onions. Blood tests that were done 2 and 4 hours later showed that the onions blocked the harmful effects of fatty foods completely. Cooking techniques such as frying, sauteing, punching, microwaving, baking, or grilling destroy some beneficial compounds in onion, so the best way is to eat raw onion. Buy mild onions that are less pungent but sweet. Don't forget to add raw onions to your salads, sandwiches, dips, and dressings. Garlic. One of the most powerful and well-known anticoagulants is AHOIN, and it's contained in garlic. Here are some tips on how to get more AHOIN from garlic, according to Professor Mahendra K. Jain. Don't cut garlic but crush it. This will release enzymes and allicin that converts to AHOIN. Don't fry garlic too hard. Still, short heat treatment will do well. Cook garlic with tomatoes or add it to other sour foods. Even a small amount of acid will promote the release of AHOIN. Infuse crushed garlic in vodka for a few days without a lid. This will also boost the activation of AHOIN. Fish. A new study showed that a high intake of fish was associated with a slightly reduced risk of developing a venous blood clot. The study participants who ate fish at least 3 times a week had a 22% lower risk of developing venous thrombosis compared to those who ate fish 1 to 2 times a week. By supplementing with fish oil preparations, the reduced risk became more significant. Study participants who ate fish at least 3 times a week and additionally supplemented with a fish oil preparation achieved a 48% reduced risk compared to those who ate fish 1 or 2 times a week and did not supplement with fish oil. There are good and solid evidence for the health benefits of omega-3 fatty acids that is contained in fish and fish oil. More recently, a new scientific study from Norway shows that supplementation with fish oil either equals or is better than eating fish regarding the reduction of venous thrombosis. The combination of fish and fish oil supplements can reduce the risk of venous thrombosis by almost 50%. Researchers from Harvard have made the same conclusion. They say that eating 195 grams of canned tuna thins the blood no less effectively than aspirin. The antithrombotic effects occur in about 4 hours after eating the fish, so the beneficial antithrombotic effect can be achieved by eating about 150 grams of oily fish, like mackerel, herring, salmon, and sardines, or about 180 grams of canned tuna. Tea. It might seem strange, but tea actually prevents the formation of blood clots in arteries. In 1967, Nature, the British scientific journal, published the unique photographs of the aortas of rabbits fed a diet high in fat and cholesterol. The point is that some rabbits were given just drinking water and the others were given tea instead. The aortas of tea-drinking rabbits were much less damaged by the high-fat diet. So the researchers at Lawrence Livermore Laboratories in California concluded that tea ensures almost 100% protection of the arteries. They pointed out that the arteries of Chinese Americans who drink tea regularly are in better condition than those of European Americans who prefer drinking coffee. The general condition of coronary arteries was 30% better and of cerebral arteries 60% better. The scientists were actually ahead of their time, suggesting that tea contains some unknown substances that prevent the arteries from clogging. The research, presented at the first International Scientific Conference on the Physiological and Pharmacological Effects of Tea held in New York in 1991, shows that tea protects arteries by changing the factors of thrombus formation. The substances in its composition reduce blood clotting, prevent the activation and accumulation of platelets, stimulate the process of dissolution of blood clots, and reduce the deposition of cholesterol on the walls of arteries. It provides good protection of blood vessels. In the studies conducted on animals, the equivalent of 3 cups of tea significantly reduced the platelet accumulation and so prevented blood clots. Vegetables. To prevent thrombosis, eat fruits and vegetables rich in vitamin C and fiber. The Swedish study of 260 middle-aged adults showed that those who eat lots of fruits and vegetables have less problems with blood clots. In those who eat less fruits and vegetables, the process of dissolution of blood clots in the vessels turned out to be slower. Some other studies show that vitamin C and fiber contained in vegetables and fruits stimulate the dissolution of blood clots and so slow down the platelet accumulation. Red hot pepper. Studies show that hot peppers may prevent blood clots and heart disease by increasing blood flow. It's all due to capsaicin, the natural chemical that puts the hot in hot peppers. While clinically proven to relieve headaches and sinus inflammation, capsaicin may also be the key to a healthy heart. Because of its unique thermal heat action, capsaicin also increases metabolic activity, promoting natural weight loss. Yet one of the greatest benefits of capsaicin is its proven ability to increase circulatory blood flow, thus preventing abnormal clotting, which can lead to heart attack and stroke later in life. Clinical studies have shown that when ingested, capsaicin activates the body's circulation process dramatically. Unlike drugs with stimulant side effects, capsaicin promotes circulatory blood flow through its natural ability to conduct thermal heat, while also inhibiting the nerve receptors that cause swelling and pain. Several studies concentrating on gastrointestinal diseases have found that capsaicin also increases blood flow to the stomach and stimulates the production of gastric juices. The studies lead to a conclusion that the unusually low rates of gastric and colon cancer in Latin America may be directly connected to the high dietary intake of capsaicin in that region. Other beneficial spices. Some other spices can also protect you from bad blood clots. Krishna Srivastava from Oden University in Denmark studied 11 kinds of spices and found that 7 of them have the property to inhibit the platelet accumulation. The most powerful of them were cloves, ginger, cumin, and turmeric. In this regard, cloves are even more effective than aspirin, Dr. Srivastava said. The main active ingredient in cloves is eugenol, which also helps platelets retain their form after being accumulated. Dr. Srivastava claims that spices can affect the prostaglandins in our body, so they have the same effect as aspirin, garlic, and onions. Olive oil. Eating foods prepared with olive oils that are rich in phenols, substances that have beneficial effects on the heart, may help ward off harmful blood clots in people with high cholesterol, Spanish scientists report. They have found new evidence of the healthy effects of virgin olive oil. To investigate, the researchers had 21 people with high cholesterol eat 2 different breakfasts. For 1 week, they consumed either white bread with virgin olive oil containing 400 parts per million phenols, or white bread with olive oil from which much of the phenols had been extracted, leaving it with 80 parts per million. Study participants were then switched to the opposite meal. 2 hours after the high phenol meal, study participants' concentrations of factor VII antigen, which promotes blood clotting, were lower compared with the low phenol group. The high phenol group also experienced a greater drop in the activity of another clot promoter, plasminogen activator inhibitor 1. Blood clots are caused by high-fat food. A high-fat meal can spark a dramatic rise in a blood coagulation factor, which may increase the risk of death from heart disease and stroke. It's interesting how dietary fat affects serum cholesterol, which is associated with coronary disease. The new study indicates that fat from the diet, even the so-called monofats, also may increase the risk of heart attack and stroke by increasing the activity of factor VII, a blood clotter. In the study, healthy adults who used to eat fatty foods regularly switched to different diets that were lower in fat for 2 weeks. All of these diets reduced the tendency for blood clots by 10 to 15%. Many studies also confirm that fats, animal fats in particular, slow down the dissolution of blood clots. Another recent experiment have shown that meat fats stay in the bloodstream and harm the vessels for up to 4 hours after being consumed. Breakfast that destroys blood clots. For many years, scientists were confused by the fact that most heart attacks occur in the first few hours after waking up. One of the reasons may be that people don't have breakfast, assumes cardiologist Renata Sivkova. She found that giving up breakfast increases the risk of clot formation by almost 300%, making the person more prone to heart attacks and strokes. Dr. Sivkova explains that the stickiness of platelets is low at night, and when you wake up, it rapidly increases. And for some mysterious reason, having a meal in the morning makes platelets less sticky again. Nutrition tips for blood clots control. When a person learns that they have a blood clot or that they're at risk for developing a blood clot, they may begin to make healthier choices in their life, including a change to a healthier diet. Some of the healthiest foods that you can eat, including foods like broccoli and spinach, are high in vitamin K. It's always very important to understand how different things like food might affect the way your medications work. However, if you eat these very healthy foods that are rich in vitamin K consistently, in the same amounts over time with no sudden changes, you can enjoy the wonderful nutritional benefits they provide as part of a healthy diet. You should talk to a healthcare provider before making any changes in what you eat. You can also talk to a registered nutritionist to help make sure that your food intake is healthy and consistent. The United States Department of Agriculture has a nutrient database that provides information about vitamin K levels in many of the foods you might choose. That's all we wanted to tell you today. On Big Progress, you will find videos about the benefits of various vegetables and fruits, information about diseases and how to cure them, and many other interesting facts about gardening and housekeeping. So make sure to subscribe to the channel and ring the bell, like the video if you've learned anything new, and share it with your family and friends. See you soon!